Welcome to Unit 1, Identifying At-Risk Groups, Clinical Assessment. By the end of this unit, you will identify patients or groups at higher risk of negative health effects from exposure to air pollution. Air pollution is a risk factor for health in both healthy and sick persons, whether patients or individual in general. The first step is to identify clinical situations where air pollution might be involved as an upstream risk factor. Upstream risk factors refer to the set of non-medical factors that impact health. They are related to the economic, social, and physical environments that occur outside the healthcare system. When consulting with a patient, it is important to think about the determinants of health that may play a role in the vulnerability of a person. For example, is the person living in poor conditions close to air pollution hotspots? Is the person being exposed to smoke from the use of unclean fuel and devices for cooking at home? Although air pollution exposure is hardly accessible in the clinical examinations of patients and not clearly recognized by simple blood tests or other exams, it causes a real and tangible health burden. While this stream of work is still in progress, clinical risk scores and tools for risk stratification could include consideration of susceptibility and vulnerability factors and levels of air pollution. This would be useful for guiding decisions about personal interventions. Some researchers have developed tools that you can consider as initial examples. As an example, a clinical screening tool will be presented in the reading materials for this unit.
By the end of this unit, you will describe how to communicate health messages to patients or at community level to minimize exposure to outdoor and household air pollution. Key messages for outdoor air pollution reduction strategies include: reduce exposure to traffic-related air pollution by commuting at less congested times of the day, or, if walking, running, or cycling, to commute on less busy roads. Exercise away from sources of pollution, such as busy traffic. Community waste should be collected and managed effectively instead of burned in open air. In case of wildfires, leave the area if possible. Close windows or use indoor air filters, as well as wear masks where appropriate. And finally, know your number. Where available, consider using the Air Quality Index to know more about the air quality in your context and how you feel. While this might seem obvious, your voice matters and can have a positive impact on behavioral change. An Air Quality Index communicates to the general public current and forecast ambient air quality conditions based on one or more air pollutants. An Air Quality Health Index is similar to the Air Quality Index. It communicates the risk to human health based on current and forecasted ambient air quality conditions with health messages to reduce exposure for both general population and high-risk groups. These indexes can communicate health messaging that encourages individuals to reduce personal exposure to ambient air pollution based on current and forecasted pollutant concentration levels. Separate health messages are provided for the general population and the at-risk, susceptible, or vulnerable population who are more sensitive to the adverse health effects of air pollution exposure. If available in their countries, healthcare workers can use air quality indices when counseling patients and individuals about the risks to their health from exposure to air pollution. However, it is important to note that in addition to the AQI, it is crucial to know the actual concentration of the individual pollutants that are included in the AQI summary, as people can be sensitive and react to different pollutant concentrations differently. Much like a weather forecast lets you know if you should pack an umbrella, an air quality forecast lets you know when you may want to change your outdoor activity plans to reduce exposure to air pollution. Many forecasters also provide information about when pollution is expected to be highest during the day, whether there are times when air quality is expected to be better, health advice for the population based on the air pollution levels, and which regions are particularly exposed to high air pollution levels. You will review some examples of air quality health indexes later in this module. Let's now consider key messages to minimize exposure to household air pollution for both individuals and communities. Healthcare workers can advise patients to minimize exposure to household air pollution by changing behaviors, such as reducing the time spent close to the pollution source. This is especially important for susceptible groups such as children. Changing cooking practices, for example, fuel drying, pot lids to conserve heat, choosing food preparation that reduces cooking time, or avoiding smoke. For example, if possible and safe to do so, keeping children in another room away from the source. Minimize concentrations of household air pollution within the home through improved living conditions, such as improved ventilation, for example, chimneys, windows, vents, and so on. Kitchen design and placement of the stove, for example, separate kitchen from the rest of the house wherever possible and reduce family exposure. And minimize emissions from fuel combustion by burning fuels more efficiently or using cleaner fuels such as LPG and electricity. Reducing household air pollution emissions also involves keeping the home and fuel dry. Damp fuel emits more air pollutants than dry fuel when burned, and dampness in buildings is also associated with an increased risk of adverse respiratory outcomes. Reducing concentrations of emissions through ventilation lowers their accumulation indoors and therefore improves the quality of indoor air. However, venting high concentrations of household air pollution will increase outdoor air pollution. Healthcare workers should prescribe clean household energy solutions for patients and communities.
By the end of this unit, you will describe the relationship between physical activity and air pollution. Staying indoors and/or reducing physical activity are standard public health precautions for reducing exposure when air pollution is elevated. However, this may not be possible for some individuals or groups. Each population, by age, sex, and health status, should receive specific advice on modifying their physical activity according to their level of exposure to specific air pollutants. Research has shown that in healthy adult populations in high-income countries, the long-term benefit of regular physical activity in reducing mortality outweigh the adverse effects of air pollution for PM2.5 concentrations of below 100 micrograms per cubic meter. Additional studies are needed to increase the evidence for low and middle income countries, population other than healthy adults, pollutants other than PM2.5, higher levels of PM2.5, and unintended consequences of alerts about air pollution on overall physical activity. With exposure to air pollution, the short-term benefits remain but are reduced. In general, regular physical activity should be promoted even if the local air quality is not optimal. The timing and location of physical activity should be adapted to reduce exposure to air pollution. Any recommendation should also consider ozone and temperature levels, especially in warmer climates. Patients who take medication should follow their physician's recommendations, for example, adapting the asthma treatment during episodes of high air pollution. In accordance with the precautionary principle, populations at specific risk because of their health status or occupation should be advised about the best time and location for physical activity or for work, and to reduce moderate to vigorous physical activity or outdoor work during episodes of high levels of air pollution.